It's the role of VEGF in Alzheimer's is a bit complicated. So the concentration of VEGF is increased in Alzheimer's disease, which isn't that surprising because there's reduced oxygenation of the tissue. And we know this from studies of people with autosomal dominant forms of Alzheimer's disease, that you get reduced blood flow and oxygenation at a very early stage. Ordinarily, you'd expect an increase in VEGF to induce angiogenesis. It's part of the homeostatic response to try to induce the formation of more blood vessels to restore blood flow. But it doesn't seem to have that effect in Alzheimer's disease. So we've looked at the density of small blood vessels and cortex and white matter in Alzheimer's disease, and it's not increased. If anything, it may be slightly decreased. Why should that be? So we've been looking at other components of the pathway, including the receptors. And some of the receptors, VEGF receptor 2, promote that angiogenic effect, but other receptors have the opposite effect, and particularly a soluble variant of VEGF receptor 1 tends to antagonize the angiogenic effect that you would expect by elevating the level of VEGF. And we found that that soluble receptor in particular, that soluble variant of receptor 1 is increased in Alzheimer brain tissue. So that may be one of the reasons why they don't show the angiogenic response that you might expect.